than I've seen in a board meeting.
I just saw we have 40 people.
We are recording according to my PC, so.
Yes, we are.
Okay.
So I want to welcome everyone. Thank you, Diana. Thank you, Emily and Sheila, for helping us set up. I'm getting a weird echo, so hopefully that stops. We do not have any submissions for open or for public comment right now, but our staff is watching the online submission form, and then they're also watching the chat. So if someone does want to make a comment, they can fill out the form or they can chat and we'll let Judy know. And with that, I'm going to turn it over to Judy.
It's showing unmuting. Can you hear me?
Yeah,
Yes.
Okay, great. Yeah. Before we get rolling, I just want to thank everybody, our administrative and staff members throughout our provider network for doing heroic work. These are such uncertain and troubling times. I appreciate the effort and the interest of our board members, all in sharing their commitment to the people we serve. This has been so unsettling to so many people. I'm sure you've all heard from a lot of them. And having this meeting has actually been a moment of calm. So I think that it's a very good thing that we're going forward. And as we go, I'm anticipating that I'll get better at this. So without further ado, I'm going to ask Sheila to call the roll.
Okay, Miss Newman.
Remember to unmute.
Can you hear me? Yep.
Now we can.
Thank you.
I'm here.
Okay, thank you. Dr. Todd?
Here.
Dr. Hahn? Mr. Landsman?
Here.
Mr. Furman?
Here.
Miss Guadalupe?
Here.
Miss Bernard? Mr. Torres?
Here.
Mr. Kemp?
Here.
Mr. Lindemeyer?
Here.
Miss Namie Dyer? You
Here.
can correct me. All right. And then Miss Summers?
Here.
Okay.
Thank you. And at this point, I'm going to turn the facilitation over to Anya.
Okay. So somebody let me know if you can't hear me or anything, but from what I can see, you can. So we wanted to take this particular board meeting as an opportunity to just bring everybody up to speed on what we've been doing for the past 2.5 weeks, along with our staff, all of our providers, and everyone that has been extremely focused on the COVID-19 response. It's been overwhelming at times, and it's really also been pretty great to see our network and our staff and everything come together to try to make this work, because we certainly did not expect this to change this fast, be implemented this fast, and all of the changes that are coming at us as fast as they are, trying to make sure the network is aware and able to continue to serve people has really been our primary focus. So I appreciate everyone's patience while we try to focus on that and kind of set aside anything that's not been particularly urgent. So eventually we'll get back to one of the things I want to let you know is that we'll plan for the regular committee of the whole meeting, and any items that people have submitted questions for that we don't answer today, we'll plan to address those at the committee of the whole. And hopefully by then we'll all be pretty well versed in how to do these online meetings and kind of get some normalcy back in the frequency and structure of our meetings. So with that being said, we have posted a plethora of material on our website and sending out via provider bulletin, board updates, and all those types of things. And what the plan is for today is for us to kind of walk through some of those things that we've been working on so that both the board and the public have a better understanding of kind of what our response has been and what we've been doing with the provider network to make sure that they are continuously able to serve the people of Oakland County. So one of the most urgent things that we found was providers and people talking about funding. And so one of the more earlier calls we had with the department was related to a couple of things that they're working on with what's called an Appendix K and an 1135 waiver. And so those waivers make some significant changes related to not just funding, but the allowability of Tele-med and other things like that that we'll get into. But it gave us the opportunity to do funding a little differently and assure funding for some providers that are essentially closed right now, or their business is drastically different right now than it would typically be. So what we in turn did was essentially to turn our provider contracts back into cost reimbursed contracts. And for those of you who don't know this, before we had all of these service models, that's really how we funded providers. It was they have to follow all the Medicaid rules and regulations. It has to be proportional to the amount of business they have with OCHN. And what they do is then basically submit their costs to us and we reimburse them those costs. So how that will work for a provider that's funded on a fee-for-service basis, for example, let's say a residential provider or something like that, or vocational for the services they are still providing, is that they will still submit encounters. We will adjudicate those claims, but then they will follow that up with a document that shows their actual costs compared to what they did get reimbursed for. And we will go back and reconsider the claims to make up the difference. But what that looks like for a core provider, again, they still submit all of the encounters, but we basically take the average of the last 6 months funding and pay them that on a monthly basis, and we'll reconcile that in a cost reimbursed model and cost settle that time period independently of all of our service models. So this is really how we used to pay them before we moved to service models. And in a time period like this, we really felt like this was necessary so that providers didn't have to focus on funding. They knew cash was coming in, so they had money to pay their staff, and they just could take that worry off the table and focus on providing services to people. Because that's really been our, short-term mission right now, is just making sure that people get served. With all of the things changing, the last thing we wanted people to be worried about was funding. So we went ahead and did that. We're working on the amendments to make all of those adjustments in contracts, but that's something we've assured the providers that will continue during this period, just so that they know they don't have to be worried about that. One of the other things that's been going on is we've been meeting with the department twice a week now, and they've given us some information related to what they're working on from a funding perspective and how they're working on getting additional funds related to COVID-19 and how they will be funding us. So there's a lot that's kind of in the works that has to be submitted to CMS for approval, but it's all very good steps that I believe they're trying to make sure that we have the appropriate funding, and that what we're faced with is getting reimbursed, and as soon as CMS approves that, then we can we'll know better the amount that will be. But in the meantime, I think I mentioned it at the last board meeting that was right after the rate setting meeting I had gone to, and that the department did come to the conclusion that the rates they were pushing out were not sufficient to what we were actually receiving. So they were going back and doing an amendment to the rate certification letters. And what they did end up telling us they would be doing was that what they owe us year to date, they're intending to give all of that to us in April. So for us, that's really good in that it will help the cash flow problems we've been having. So as I've mentioned before, cash flow has been pretty tight. And what we did, I don't know, probably almost a month ago now, and let the board know in a board update, was we liquidated about $1 million worth of investments just to make sure that we didn't hold up the cash flow to any provider. We wanted to make sure we were liquid enough to be able to fund providers and keep them moving forward so they could pay staff. And so this money coming in April, which will be the year-to-date money that we were expecting, should help that considerably. And then in addition to that, they will be adjusting the rates for the remainder of the fiscal year. And then, like I said, they're requesting from CMS adjustments for what is essentially called hazard pay. We're calling it more of enhanced compensation for those staff in the network that are still forward facing to the community. So anybody still providing face-to-face services, which each provider has the discretion, as long as the code is on the MDHHS chart, they're allowed to provide it face-to-face, but as long as they feel like it is absolutely necessary and they're taking precautions from an exposure perspective. So for those staff and any staff working, let's say, in a group home or within a facility of any sort, they are getting an enhanced compensation amount just to recognize the enhanced risk that's going on with their job right now, and the change in unemployment benefits and things like that. We're trying to make sure we're creating a stable enough system that people aren't deciding to go to unemployment as opposed to showing up for their jobs. So that's been one of our bigger concerns the last few weeks, is making sure that people still want to work and people still show up for their jobs, and we're kind of handling the funding situations as they come if there are challenges that any particular provider is facing. From an ongoing perspective, we'll get the funding in April, and that's, as I mentioned, going to help cash flow significantly. So roughly in any given month, we need $23 to $24 million in cash to pay providers. And so from the last couple of fiscal years working in a deficit budget and like the building and things like that all have a drain on our cash flow. And so one of the things that has been kind of something that's been a challenge for myself and the finance staff is really just making sure that as the money comes in, we have the money to make sure providers are paid, because it's always been our stance that we don't, if at all possible, we don't want a provider to have to use a line of credit, or certainly not have to pend any payments to any of their staff or anything like that. So we try to be really flexible with that. And that's been exceptionally hard the last probably year, just with the way the budgets have been. And I really do hope that this makes up the differences, so that we're a little more liquid and we have the flexibility that we've consistently had since I've had this role until probably the last year and a half. So I do expect it to get significantly better, and the department did recognize finally that the money they were pushing out was not equating to what they had projected. So that was some really good news, and we're pretty happy to hear that. I think that's it for the most part with funding. Like I said, our focus has really been to try to make funding not a concern for providers and make sure that they have the flexibility to make sure their staff are coming in and things like that. And so that's been an ongoing conversation, and we're continuing to work on any of those challenges as they come up. So with that said, I will turn it over to Diana to talk about service delivery and telemedicine.
Just as Anya had said, we've really had to pivot over the last few weeks. And one of the ways that we've had to do that is with service delivery. Obviously, we like to call it physical distancing instead of social distancing, how our providers are delivering services that can be delivered via Tele-med and telehealth has been really critical. So all of our providers who can are providing services that they can via telehealth. We had providers that were in different readiness, but one of the good things that happened was the ONC, who manages HIPAA, has changed the rules around HIPAA and Tele-med. Previously, what you had to do, it was in order to deliver telehealth, you had to use a HIPAA compliant tool. We got guidance about 2 weeks ago that was changed. So what it did was enable people to be able to use things like Google Hangouts, Messenger, on Facebook, and FaceTime. So that really allowed our providers to be able to adapt quickly. Additionally, which was really great news, is that the state is also allowing phone conversations to be considered telemed. So it doesn't have to be with video. We do have some providers that already had telehealth platforms in place, and they are using those and then using the tools that work best for the people that they serve. In addition, what we found is that, of course, just like, and I'll get into more about what OCHN has done to support our staff during this, we also had our providers who needed to change to a mobile / work at home workforce. Most of our providers who have, or I should say all of our providers who can have staff working at home, they are. And we also have been working with any specialized residential homes that need to have the technology in place to provide telemed. We will reimburse them for that. So what we want to make sure is that if someone is in a home and that they need telehealth, that they can get those services with their provider. As far as staff, we made the decision almost 3 weeks ago in knowing that we were going to need to have everybody working from home. Obviously, none of us at this time know how long it's going to be, but we know that it's going to be for the foreseeable future. Unfortunately, OCHN has been a very technologically advanced organization well before my time and had really made sure that we were making choices to promote that. As our board knows and staff knows, we moved to Office 365 18 months ago, and making that decision really has allowed us to be able to have a lot of flexibility. Since I have been the Chief Information Officer, what we have done is we have adopted what's called a cloud first strategy, meaning we will always select an app that can be in the cloud and that we don't have to have someone on site to use, because I wanted to make sure that we had people had that would support people being able to work from anywhere. So as we started knowing that folks were going to need to be able to telecommute, what we did was we identified who had desktops. We made an emergency purchase of 30 laptops so that all employees had an OCHN issued laptop to be able to work from home. Because we also made the recent move to Microsoft Teams for our phones, everything just continues. Someone can pick up their desk phone or the customer service phone right from their smartphone or from their OCHN issued laptop. Also, staff has been supported remotely by IT, and we have worked through some of the challenges that we have for that, but everything and everyone seems to be working pretty well. We did receive some questions about the building, so I want to address those. Our building is closed, and we only have someone who comes into the building Monday, Wednesday, and Friday, who gets the mail and scans the mail to whoever needs to be able to receive it. Facilities has been in, if we know that we have deliveries coming, especially for those supplies of our personal protection equipment, receiving those deliveries and helping get those organized. CHN has 1 or 2 staff that are in the building every single day to also get mail, but for the most part, our building is sitting empty. Before we have everyone return to work, we will have the building professionally cleaned by a company to make sure if there are any or traces of COVID that would be left, that those would be cleaned and sanitized. That addresses everything that I have, so I'm going to turn it over to Nicole.
Hi, good afternoon, everybody. I'm going to go over some of what we've been working on in terms of support to our provider network as well as our staff. I know that there was some requests for information just related to the overall impact as we know it. I will say that in terms of positive diagnosis for COVID-19, or even unfortunately deaths associated with a diagnosis of COVID-19, the data isn't necessarily the best. Testing, as you probably know, is incredibly limited. So a lot of what we're hearing are presumed positive, which is essentially anybody that's exhibiting any symptom is just told to presume that they are positive and kind of shelter in place, so to speak, so as not to continue to spread the virus. So I'll give you some aggregated data. Certainly in your board updates, we can be a little bit more detailed, but just out of respect for the privacy and confidentiality of the folks that we serve as well as our providers, I'm just going to give it at an aggregated level for now. We know of 10 people that we serve who have confirmed positive diagnoses and about 20 provider staff. We have unfortunately 3 deaths that we are aware of and no deaths from provider staff. In terms of our own staff, we do know of folks who were exposed, but nothing in terms of positive diagnoses at this time. So how are we trying to think outside the box and provide support beyond the funding, which, as Anya had said, was the most critical piece from our standpoint? We have been ordering as many supplies as we can. As you know, there is a nationwide shortage of a lot of the personal protection equipment. And certainly we thought that we could put our contracting power to work instead of asking all of our providers to do it individually. So our contracts and procurement team have really been scouring the web pretty well day and night, reaching out, vetting contracts, doing purchase orders. And right now, I'm very happy to say that we've received gloves, disposable face masks, some KN95 masks, gowns, and hospital grade disinfectant. We are able to give gloves and disinfectant across our entire network. We do have to prioritize the issuance of the personal protection equipment to those homes where we have people who have known exposure to the virus and who may be exhibiting symptoms simply because there just isn't enough to go around. And in our partnerships with the Oakland County Health Division, they have been supplying the PPE or personal protection equipment to those providers where they do have a positive test diagnosis, but because it's so limited at this time, that's the only time that they are able to provide that equipment. So we continue to look for masks. We have ordered face shields, hand sanitizers, as well as touchless thermometers to continue to support the network. We have regular meetings with them, with our residential providers. It's every Friday at noon, just to go over any new information we may have learned in the course of our meetings with the department. They, of course, bring those concerns to us. We've been able to then advocate to the department of things to add to the Appendix K or the 1135 waiver. We've also advocated with LARA to waive certain requirements, such as TB testing in the interim, simply because they can't find anywhere to go and get any new potential staff tested at this time because most of the locations have been closed. We did work very closely with the Oakland County Health Division. We have a secure point of contact with them that whenever we do have a person that we support that has a positive diagnosis, we are able to reach out to that one individual who then helps to get resources, answers any questions related to best practice as far as how to support not only that person, but anybody else that we serve that may have been in close contact with that individual. The Oakland County Health Division also put on a webinar that was specific for our residential providers and the unique challenges that they're all facing at this point in time. There was time for Q&A. They did a really great job of providing an overview of the virus and its impact, and that is posted on our website as well. We're also looking into housing options. So we have a unique situation in that what some providers have expressed to us is some may have been exposed to someone with a positive diagnosis or who is presumed positive, and because of their living situation, they might live with a high risk person. They're worried about continuing to work and going home. Conversely, we've also heard from some providers that they live with folks who may have been exposed, and they're worried about bringing that to work and exposing the people that they support. So to that end, we are looking at housing options just to maintain staffing in our network. And so we have contracted, we're working on a contract right now with the Lasser Respite Home because it was currently empty. And so they have really stepped up to the plate to work with us around using that for staff to have a home or a place to go to during this time. And then we're also exploring, there are hotels that are offering $39 or $59 a day rates for staff that are in those types of situations as well. So we're looking at providing that support. We have what I'm referring to as our OCHN Volunteer Brigade. So we had staff very early on that, in addition to all of the hard work that they're doing day in and day out, they wanted to go above and beyond, and they wanted to do something extra to support our providers. And so to that end, we have a list of volunteers from OCHN who are willing to go out and pick up supplies, who deliver supplies to a lot of the residential settings to avoid from having staff or the people that we support having to go out into the community or getting additional exposure to obtain those supplies. So tomorrow we have, I think, between 25 and 30 folks that are ready to hit the road and go out to over 200 of our sites to deliver gloves and disinfectant and other personal protection equipment as needed throughout the network. We're also providing some support at our Resource and Crisis Center. So because of their facing some of the same staffing concerns in terms of nurses and trying to follow a lot of the best practice related to taking people's temperature and making sure that people don't have an increased risk before coming in for services. Our nurses have both stepped up and offered to go work into the lobby at the RCC and take people's temperature and help that way. We also have a nurse who is in our jail now 7 days a week dispensing medication for medication assisted treatment. The nursing services in the jail were very tapped in terms of staffing, and so our nurses have really stepped up to the plate to help out where they're able to. We've also been working very closely with Pontiac General Hospital. They have been a really great partner in terms of reaching out to us, trying to come up with some creative ways that we can provide some additional resources to our network. One of those is that we do have a contract in place for up to 50 beds if people need to quarantine. So if you have folks who are sick or exhibiting symptoms and we need just a different place where they have quicker access to medical care, or for whatever reason they don't have a viable housing option, that they can go there. We are expected right now, however, to provide the staffing there. Sorry. So we're working through just some of the staffing issues related to that. We're also exploring additional opportunities with Pontiac General related to if we have any psychiatric overflow from the OASIS unit. I'm happy to say that right now we do not have that experience. We have been able to get folks into acute care psychiatric treatment as needed. However, very recently, I think just as recently as yesterday, we did receive notification that a couple of the acute care hospitals are not open to any new admissions. One was through this Friday and one is through next Friday. So we're just trying to anticipate now some of the needs so that hopefully we have resources available ahead of time instead of trying to be reactive. We're also looking at the ability to support our SUD network for withdrawal management and for residential services. They have the same impact related to staffing and direct support professionals as our residential providers do. And so just looking to make sure that we are supporting all of our service providers across the board. We're looking at working with Pontiac General to see if they can't take some of the overflow from withdrawal management and from SUD residential services. We're also looking at cleaning assistance. So just trying again to centralize the research, the procurement for cleaning or sanitizing of homes, which would be, I think the term Anya used, appropriate and allowable expense in response to this virus. So essentially doing anything and everything we can think of at this point to take the burden off of the provider from having to look for those things and really trying to take that on ourselves and offer those resources so that they can really focus on appropriate staffing and service provision. In terms of how we're supporting our staff, Diana really talked about the deployment of laptops and other materials so that people could work from home, and our IT team really did step up and they knocked that out of the park to make sure that staff were supported, that they had everything that they needed to be successful as we've moved to a virtual workforce. Our communications team has helped us to implement, we call it a What's Up Wednesday. So instead of monthly staff meetings, we are now getting together as an entire organization once a week, just to say hello, to turn on our videos and see each other's faces. We're doing raffles and drawings of lunches with executive leadership once this is all said and done and we don't have to physically distance anymore, as well as small gift cards to like a DoorDash or another food delivery system. We are also offering enhanced pay for any of our forward-facing staff, the same way we are with our providers. So we do have essential workforce staff. We've got a presence at the RCC for our access team. Certainly I touched on the work that our nurses are doing, and then the staff that we have embedded in the jail, providing some therapy and some discharge case management services and things like that. They continue to go out every day and provide those essential functions. And so we thought it was important to ensure that they had the same access to that enhanced pay as our provider network did. And then we're really just supporting other ways for them to stay connected. Doing video meetings, we're encouraging folks to turn on your videos, like Anya said, use the funny filters, kind of find the light and the bright and the connection wherever we can at this point. The Teams meetings have been a big help. We've had photo challenges that our communications team puts out once a week. Last week it was sending in pictures of you and your dog, or cat or pretend dog, or just you. And they put together a really great PowerPoint for us all to see at the end of the week. And this week we have a breakfast challenge. So what kind of fancy schmancy breakfast can people come up with and post pictures of so that we can vote for a winner of the breakfast competition. And then today on our What's Up Wednesday, we wanted to still make sure that we are focused on our mission. That's our everyday mission, our all the time mission. And so we all wore blue, and we celebrated the Lighted Up Blue for Autism Awareness together on the meeting today. That was it for my notes related to how we're supporting our provider network and staff. But I would be remiss if I didn't wind that up by saying that our providers have just been absolute and true heroes through all of this. Everything that they're doing has really been just blowing us away, and the way that everybody has come together is a definite bright spot through everything that we've been going through for the past 2.5 weeks. So with that, I'm going to turn it over to Anya, who's going to talk about, I think, some ongoing challenges that we're still trying to work through.
Yep. So challenges are not few and far between, to say the least. But what I can say is we've been working through them and just doing what we can when we can and trying to help as best we can. So one of the biggest things right now has been the personal protection equipment. I think the entire country is frantically scouring any organization that has any. As Nicole mentioned, our staff is doing the same. We've gotten some, but that's been an ongoing concern. I think even when people aren't confirmed positive or presumptive positive, I think it's just people are scared, and we are doing our best to get what we can and get that out to people as fast as we can. But that's definitely been a challenge that we've continued to be working on, and continuing to reach out to anybody willing to share a lead or a contact or whatever, just so that we can try to get that protective equipment for staff of provider agencies. One of the other challenges has been how to quarantine people if they are presumptive positive or confirmed positive. That's a bit challenging, but we've come up with a couple of different options Nicole mentioned, and we're working with providers as those situations come up and trying to help them problem solve and come up with ways to make sure those locations are staffed and people are safe and still getting the services they need during that time period. Continuing, we are getting, I would say, 98% of email is all about COVID-19, and it is fast and furious. So, you know, everybody's doing their best to scan the information as fast as possible to determine, does it need to go out today? Is it one that we can try to coordinate and consolidate to an end of the day distribution to try to not overwhelm everyone else? But just the amount of information and the amount of change happening at the pace it's happening has been a bit difficult. I think at this point we are a couple weeks into this and have kind of a system of how to make sure we're getting things out that need to go out as soon as possible, but also trying to limit the continuous feed of updated things, recognizing that people need to be able to focus not only on their inbox and actually getting some things done. One of the bigger challenges has also, as we've brought up, is the staff exposure, being staff at provider agencies and other places, and how to handle that and what to do if and when they're showing symptoms, and working with the health department on how to just problem solve through that and make sure that we're doing our best to help keep people safe and healthy and prevent any additional spread that we can. One of the questions we got is really what our plan is right now from a telecommuting perspective for our organization. And I think as of right now, we're talking about April 30th. Certainly, should things get drastically better before then, our plan would be to go back. But right now, with that being kind of the recommendation from the governor, I think we're going to stick with that until something changes, and we'll continue to update that as things go on. So as I mentioned, our goal will be to start to get back to a normal schedule from a board meeting perspective. So we'll be planning for the committee of the whole as usual, and planning to have any questions or topics on there. I'll be working with Judy to determine what topics should stay on there that we had previously set up, what maybe needs to be tweaked, and then just looking at the things that we didn't get to last month, and do any of those need to make their way to this month's agenda. I know I have financials you all haven't seen from January and those types of things. So we'll kind of try to think through that within the next week or two and make sure that we're planning for that. But everyone should consider those meetings still going to happen via this format. So hopefully everybody's doing okay with this and everybody's getting comfortable with it. And then, like I said, anything we didn't answer here, we try to really remain focused on really the COVID-19 response in this particular meeting, just to get everybody up to speed and provide everybody with the information we've been sharing with the board and things like that. But like, we're going to try to get things back to normal and somewhat of a normal schedule, and just keep people updated as things evolve. And as we're able to react to this, we'll keep people updated. But we do have to continue business as usual during this. And our plan is to do that starting in April. So I think unless Diana or Nicole has anything to add to that, we could turn it over to questions, which will either need to be done via the chat or need to be done via unmuting yourself. And bear with us, I see over 106 people on the meeting. So if multiple people have questions, we might have to be a little bit patient. So obviously the chat would be the easiest way, but I know not everybody can do that if they're not at a computer. So Diana or Nicole, do you have anything to add that I missed that you want to make sure we cover?
Not anything that you missed, Anya, but maybe just a quick question regarding questions, because this is the board meeting. So is it just the board members that are allowed to ask questions, and then there's time for public comment, right?
Yes. So this would be a standard board meeting operations. I apologize for not being clear on that. It would be board members that would answer questions. But again, if you're not at a computer, we'll have to just be gracious with everybody jumping in at once if you have multiple questions. And then any public comment can come at the end, and any follow-up we can do at the next meeting.
I have a question, Anya.
Okay.
It's
Sounds like John Paul. Yep.
It's John Paul Torres. So first of all, I wanted to commend you for the work you're all doing. It sounds like you guys have really not missed a beat and got really on track with all of this in light of, the situation that we're in. But you had talked about medical equipment. So if we're looking to purchase some medical equipment that I know is very hard to find right now, is that something that we have to RFP for, or is it something we can just make the purchase on?
So in a typical situation, we would have to RFP, but in extenuating circumstances like this, we can consider it an emergency purchase. So then some of the procurement rules are allowed to be relaxed. And so in this situation, we consider this an emergency where the procurement rules would be relaxed, and our procurement staff is the one doing the scouting and the purchasing. So there's adhering as close as possible to all of the typical procurement rules, but no, we don't have to RFP it right now because it is considered an emergency.
Excellent. Thank you.
Yep.
It's Sarah Guadalupe. How are you, Anya?
How are you?
Good. Just to piggyback off of John Paul, I want to thank you and the staff and everyone for stepping up and doing a really great job, and everyone that's out there helping all the individuals that we serve. So thanks to providers and everyone at OCHN. Two questions. So the first is, do you have support for staff and providers if they needed someone to talk to? Do you guys have like a employee assistance program or just support for folks that might need it?
So I'm going to hand that one to Nicole real quick, if that's okay.
Sure thing.
Yep. Hi, Sarah.
Hey.
Yes, we do. We have our EAP. Although I like you bringing it up because I don't know that we've necessarily sent out the link very recently. So we will make sure that we do that. We've also published on the website a multitude of mental health tips, and then shared it with staff, just in terms of even changing our language from socially distancing to physical distancing, encouraging people to stay social and connected, and making sure that they do have all of those resources.
And I love the way you changed the term. That's awesome.
Thanks.
Makes a big difference.
Diana gets the credit for that one. Yep.
Yeah, I like it. And then the second thing, I think I missed part of it, but the were you talking about trying to find hotel rooms for folks? Those were non-COVID-19 that needed to get out of group homes due to potential issues with.
Yeah, so what we were looking at is, because when we're asking staff to work with people who are presumptive positive or confirmed positive, there's a real risk to them and the individuals at their homes. So recognizing that we're kind of asking a lot of them, one of the things we have been working on is a place for them to go if they don't want to go home. Because we obviously need to continue to serve those people, even if they are presumptive positive or confirmed. And so we want to be able to offer that option to those staff so that they don't have to potentially expose their family. Again, trying to just reduce the exposure to anyone and really recognize that they're going above and beyond by continuing to serve people and putting themselves at risk.
Okay, great. Yeah, because I'm seeing different places starting to open up for frontline and, police and medical professionals and things like that. So I think in addition to hotels, there's other agencies that are trying to open up that have rooms and things available. So thank you for everyone. Yep.
For Anya and Judy, one of the things that we have received a couple of messages on is, would it be more conducive, since this is an online meeting and people can't raise their hands, to ask each board member one by one if they have questions?
Sure, we can do that. I do see Jonathan has one, so I can go ahead and
That's a good idea. As a matter of fact, I made myself a list of board members to do that for both questions and board member comments. So I'm fine with maybe Sheila calling off the names, or I can do that just to keep it a little more organized. I think it's a good idea.
Okay. Sheila, do you want to go ahead and do that, and we'll go one by one?
Sure. Okay, Jonathan.
Thank you. First of all, I want to say thank you to everyone who's out there in the trenches, whether it's direct staff, core providers, or our own oversight, our own organization, working every day. I know I'm doing it from in shelter in my home for the work I'm doing, but I understand that it's much tougher when you're in the field. I know my wife works at Providence, so it does make it challenging. So I appreciate that. My thoughts and prayers with nearly 40 folks that have had tested positive or unfortunately have passed away. So the question I have is back to an early item, Anya, that you had mentioned about the 11K waiver. So beyond things like the housing that we've talked about, which is great, in the PPE gear and other things, are there other services and supports that we or our providers are providing that are COVID-19 related, that are outside our normal supports and services that we're going to now be providing some reimbursement on. That's my only question. Thank you. I think you're on mute, Anya.
I didn't know that. So the majority of what the Appendix K and the 1135 waiver are doing, we're really about reducing restrictions and limitations on things like telemedicine and some of the testing and training requirements. But I know in particular there was one related to meals. So typically meals and food is not something that Medicaid covers. That's typically required to be covered from Social Security income. And that is now something that will be in, I think it was Appendix K off the top of my head, that they will be adding. And so we can help fund that during this time period. Unless Nicole or Diana can remember anything else specific that was added outside of normal business, that's all I can think of.
This is Nicole. I would just have one thing to add to that, and that is it does allow us to pay family members to be caregivers, recognizing the staffing shortage that's going to go on.
Yep, that was one of the ones that was really good to hear, just as people choose to take family members home and things like that, and as we run into staffing shortages, that we can pay family members to provide care.
Okay, thank you, because I know that pharma scripts as well as food are both necessities, and a lot of times people forget about the pharma. One other service I think we have out there is the My Strength website. And so that's one I know is getting a lot of hype. So that's something that people can do from wherever they are if they need to go to a site and assess how they're feeling today.
Yep. So I think we posted several resources like that on our website. Anything we come across that looks useful for people just dealing with some of the stress of this and just coping with things being different right now. So we're trying to post as much information as possible on our website so that everyone can access it and knows where to go to get the most updated information.
All right, thank you. Now I yield.
Thanks.
Mr. Furman?
Hello, I just again want to echo my thanks for the support of the entire network in this unprecedented time. I was also wondering, what about folks that aren't currently supported by residential services, but they are employer of record who hire staff and so on and so forth? Any relief for the staff that help them at all?
So when you say relief, are you referring to adjustments in pay and things like that, or specific to additional staffing or things like that?
I'm talking about additional pay in that case.
Okay. So the additional pay really was intended for everyone who is still forward facing. So anyone that is still serving people face to face, the intent is that would be covered under what the department is calling hazard pay. As I mentioned, we're calling it enhanced compensation. And I do see a question from Pat that is asking about that. So the research we were able to do, the department hasn't given specific guidelines on the amounts for hazard pay. So what we were able to come up with based on the research our HR director, Edna, has come up with was up to 25%. So we've done tiers based on who people are serving. So general staff getting roughly 15% increase, and then those working with someone who's presumptive positive or positive getting up to 25%. And so we've rolled that out to all of our providers and telling them that those are the amounts we are willing to reimburse up to for those staff in those situations.
Okay, great, thank you.
Yep, Pat, if that didn't answer your question, let me know.
Well, does that pass right through to the direct provider?
Yes. So in any situation, the expectation is that, so remember, we contract directly now for the majority of direct for direct service providers. So we pay them directly, and it is our expectation that that goes directly to the staff. And so what we have told the direct service providers is that they have to keep on hand documentation to support that we would, if necessary, test before and after and what staff got that versus didn't.
Okay. So if it goes to the core provider, it just passes right through to the direct provider.
Yes, that is the expectation. So for the most part, though, we contract everything directly. Self-determination arrangements would be the exception to that for the most part. And the expectation with the court providers is that they do pass it on.
Okay. And how long is it supposed to last, or they just haven't determined that yet, just until this crisis is over?
Yeah, so we haven't really put an end date on it. It's kind of until we notify you kind of thing. And the department has used a lot of terms like no longer than 30 days or no longer than 60 days after the crisis ends. So when that is yet, we don't actually have an answer, but just until further notice is kind of where we're working from right now.
Okay.
And
Right.
Anya, I think it's important, I'm sorry, the end of that is what they're calling the end is when the state of emergency is ended. So 30 days past that.
Yeah.
Or 60.
Thank you.
Yep.
Right. Okay, great. Thank you.
Pat, do you have any additional questions since we're on you?
No, that was what I was interested in. Thank you. I think you're all doing a great job.
Thank you.
I think you're doing.
Miss Bernard?
I don't think she was on.
Can you hear me?
Oh, now we can.
Hi, sorry. Thank you
Hi.
so much for what you've been doing. I don't know, I had some trouble getting in for some reason. I apologize on that. So I might have missed this and you might have already talked about it, but I was curious if we have numbers of the people that are staying at Pontiac General from our providers. You know how you rented out the
Do you want to
space
address
for
that
them?
one?
Yeah, so I just want to make sure I'm answering the right question, Hadass. Are you referring just to the folks when I said we have the 50 beds, if people need to quarantine, how many people we have there now?
Correct.
Right now, we don't have any. Our providers have managed to be able to manage that within the homes that they own. And so we're not sure whether or not that will change, but we wanted to make sure that we had the resource available should anybody need to utilize it. But right now, the number is 0.
Okay, that's good to know. And then you may have already answered this too. Have we received those, all the equipment that you ordered, the masks and everything yet? I don't know how long it takes to arrive. I think you ordered them on March 23rd.
So we've received some, we've not received all. We have received gloves, some disposable, like regular surgical face masks. We have received some KN95, the masks with the filter in them, some gowns and some hospital grade disinfectant. So last week we were able to go deliver gloves and some gowns to folks. And this week we intend to deliver some gloves, masks, gowns, and disinfectant. So we've got our team prepared to go out minimally every Friday and deliver whatever comes in. But we have masks, face shields, hand sanitizers, and thermometers all on order. What we're faced with is we're getting partial orders, and then the rest of our purchase orders are sometimes canceled due to inventory loss, or just sometimes our whole order is just canceled. So we're kind of in the same boat, I think, as every other healthcare provider right now that's looking for that personal protective equipment.
Right. Well, thank you so much for doing that. I think my other question is, and again, I apologize if you already answered this. Do we have a number from our providers? How many people have COVID-19 as of today?
It's a hard say just because you have to meet certain testing criteria and tests are limited. So we do have the numbers. We do know that we have 10 people in our network that have received a confirmed diagnosis and about 20 staff. But again, we feel not necessarily reflective of what people are actually dealing with just because of the lack of testing.
Right, of course. But people who aren't tested just get the presumptive identified by their doctor over the phone. So do we have those?
No, I'm sorry. We don't have the exact number, but we can definitely get that to you in time for your update.
Yeah, okay, great. And then I had another question. Oh, okay. So, the CARES Act, SBA loans, and maybe you already covered this. I know we're not a nonprofit, and I know your direct staff is under 500. I just wondered, since we're quasi-governmental, can we possibly qualify since those loans are being, if we're not firing anyone, then you get the money back?
Yeah, so Edna is looking into all of those, our Director of Human Resources, and making sure that we will get the credits for anything we are allowed to take credits for related to staff. And then we also have our corporate attorney for employment looking into some of that stuff as it relates to providers and things like that, just to help provide some guidance on that stuff. But we are looking into all of that, and we will definitely be applying for any of the credits we can that we are applicable to.
Right. Actually, that's great for us. I was just thinking about that for the providers. I'm sure any of the providers that are nonprofits can apply for that.
Yeah, so certainly we're sharing all of that information, and we did get an opinion on identifying staff as healthcare workers and what that meant for them from our attorney, just to provide some insight into that for the providers. So we're trying to do what we can to provide insight, but again, balancing not telling providers how to run their business, but recognizing that, if we can get one answer as opposed to them all trying to get different answers, it could be helpful.
Right. And then I know you don't want to tell them how to run the business, but obviously, since it's first come, first serve, and it's supposed to be done by Friday, I don't know if they're aware of that, and it opens Friday, but if you're not in probably by Friday, the likelihood of the funds coming back may not be as likely. I don't know. Just commenting. Okay, I think that's it for me. Thank you so much for doing such a great job.
Thank you.
Mr. Lindemeyer?
I just wanted to give my deepest gratitude to everybody on the staff that are working so hard. My question, I think, was answered. And so I would hope that you would transmit to the staff, how the board feels about everything that you've been doing, and that the whole organization's been doing. It's really difficult during these times, and I just really appreciate all the work that you've done, and to be able to look forward and do the enhanced pay is very impressive. And so I really thank you for doing that for the employees. Thank you.
Yeah, we will definitely convey the board's feelings to staff. I think we are certainly, as leadership, trying to make sure they recognize how much we appreciate everybody coming together, and as well as providers. Like we have been just in awe of the fact that providers are coming together to share staff, to share different ideas and things like that. It's, unfortunately, sometimes it takes a crisis to kind of see people work together like this, but it's definitely been inspiring to see everybody come together and do this kind of stuff. And we are definitely sharing our appreciation for both staff and providers in doing all of that.
Okay, Ms. Namie Dyer?
Yes, I just want to say thank you again to all of you guys as well. I am going through a lot of the same things with my provider group as well. So I am definitely very sympathetic to everything that you are going through, and I think you guys are doing a fantastic job with just working to keep everybody safe and help keeping all of your employees paid and working through this really unprecedented time.
Thank you.
Dr. Taub? I'm not sure if he's still on.
Dr. Taub, are you still there? If you are, you're muted.
If you're on your phone, you can hit *6.
Okay, I'm unmuted.
We got you
I'd
now.
like. I'm back on.
Yep.
Okay, I'd like to thank the whole staff, Anya, Diana, Nicole, the whole staff, not just for holding OCHN together and making sure that all of the people that we serve are getting their services, but also it's a stressful time. Everybody's under a lot of stress, and holding this whole thing together and doing it online is even more stressful. So everybody take care of yourselves too. And I have no questions.
Thank you. We're all checking in with each other to make sure that everybody's doing self-care as well.
Dr. Hahn? I'm not sure if she's on.
Doesn't sound like it.
Okay, Miss Newman?
I'm
I
okay.
don't have any questions, but I just want to echo what's been said and show my appreciation for the effort that everyone's doing.
Okay.
And I hope you understood that because I didn't.
I did. I think I said you just want to echo what others have said and show your appreciation for everybody and their hard work, right? Hopefully that was right, and I didn't just put words
Right. And I did have one other question. I know that the association was looking for positive stories. Do we have any that we can share in our virtual meeting?
So,
as opposed to free of hope?
So I believe you're asking about the stories that inspire hope, essentially from the CMH Association. And yes, Christine is working on that and providing some of that. I haven't seen what she's provided, but she's working on pulling that together, and we can certainly share that with the board or at our committee of the whole or board meeting if you'd like.
Thank you.
Yep.
Miss Summers?
Hi, I just don't have any specific question, but I do want to really confirm my appreciation for the fact we're recognizing the first responders, frontline staff, and that we're able to do something for them that doesn't even touch all of what they're doing, but at least can hopefully make their lives a little easier. And what they do for the people we serve who are so important to us is beyond measure and priceless. So I just really do appreciate that. And in terms of the other questions, thank you to my fellow board members for asking them. So I can sign off on this part for now. If there are no other questions, though, I would ask, since the next item is board member comments, if there are any additional comments, or if we can just move on to public comment. No other questions, comments?
This is Jonathan. I don't.
That message. Okay, then I think that at this point in time, if all the comments have been made that people want to make at this time, I'm going to add one piece to other business and ask if it's possible to have some sort of summary of the information that was presented today so that we can have it in writing as a part of our archive.
Sure. We can
Okay.
work on that. I believe one of the fancy tricks of a Teams meeting is that it does a transcript or something of that nature, and we can pull that together and get it out to the board and on the website.
Okay, that sounds perfect to me. Okay, so from that point of view and having that information, I'm prepared to turn it over to the second opportunity for public comment.
Hi, Judy. It's Christine. We have over 100 people, more than 100 people, but we have no public comments, questions.
Well, I think that because the information presented was so thorough. I think a lot of the questions that people might have brought to this meeting have been answered. So congratulations on another level to all of our presenters today. So thanks, Christine, for updating us on that. If there are no further board member comments, and if Anya and her team have, this is an opportunity to say anything you might want to say. Otherwise, we can look at adjournment.
Nope. Thank you all. Thanks for bearing with us on the new version of meetings.
No, my kudos to my my fellow board members. I think it went really pretty well, and I think that mechanically in the future for asking questions, maybe we'll go back to calling on each individual board member, so that everybody has a chance. And we'll scramble it so everybody gets a chance to be first. All right. I don't want to play favorites here. So if there is no other business, any other comments, I'm going to adjourn this meeting with gratitude to all of you.
Okay, thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Stay healthy.
Yep, you too.
Thank you.